Thank you all so much for taking your time out this evening from your families to join us. Of course, I am Lorraine Cochran-Johnson, your Super District 7 Commissioner here in DeKalb County, Georgia. And we have convened tonight what is, in my opinion, one of the most important town halls we've ever had. Tonight, we will be talking about flu in the era of COVID-19. We have a very distinguished group of speakers who will be joining us. And of course, I'm no stranger to you all. Happy to serve on behalf of the community. Most of you are familiar with my background. The most important thing for you to remember is that we are ever present and available. So feel free to reach out to our office during this time. And now we'll go ahead and go into the speakers, the people that are really important. The first person that we have is my neighbor and friend, Dr. Griffin. Dr. Griffin, of course, deals with child, adolescents, and adult psychiatry and obesity medicine. He works for Kaiser Permanente. And because, Allison, I see here that there is a little bit of a cutoff in terms of the bios, I'm going to read directly from what I have. But Dr. Griffith specializes in psychiatry and obesity medicine. He is diplomat of the American Board of Psychiatric and Neurology of the American Board of Obesity Medicine. Dr. Griffith is employed by the Southeast Permanente Medical Group in Atlanta, Georgia, and is a clinical assistant professor at both Morehouse and Emory University Schools of Medicine. So thank you so much for joining us, Dr. Griffin. The next speaker that we have with us this evening is Dr. Fayto Forna. Dr. Forna is an obstetrician, gynecologist, epidemiologist, and internal, maternal, and child health expert with solid leadership in public health. She is also a writer and philanthropist who lives in Atlanta, Georgia with her husband and 4 children. She received her medical degree from Duke University School of Medicine and completed her obstetrics and gynecology residency at Emory University School of Medicine. She is a fellow of the American Congress of Obstetricians and Gynecologists. And thank you so much for joining us, Dr. Forna. Also this evening, we have Dr. Belkis Pimento. We, of course, are no strangers. We worked on quite a few things, so we always appreciate you being a part of the District 7 family. Dr. Pimento is a family medicine doctor in Atlanta, Georgia. She has been in practice for more than 25 years and graduated from Robert Wood Johnson Medical School in 1995. Currently, she serves as the Physician Program Director of Quality Performance and Population Health at Kaiser Permanente, and she is a flu expert. Thank you so much for joining us this evening. And last but not least, we have a friend of District 7. We have Dr. Lynette Wilson-Phillips. Now, many of you that are a part of this conversation this evening know J.P. Phillips, who is my constituent liaison for District 7, and Dr. Phillips is his better half. And she is a community advocate, and I couldn't be more thankful to have such great neighbors and friends. Dr. Phillips has many designations here. She has an MD, an FAAP, a FABOM, and is originally from Charleston, South Carolina, and earned her medical degree at Medical University of South Carolina School of Medicine. Dr. Wilson-Phillips completed her residency at Emory University Hospital in 1994, and she is currently president and founder of Decatur Pediatric Group, which is comprised of 3 offices throughout Metro Atlanta. And I can't leave out Kids Doc on Wheels, where Dr. Phillips has converted literally a touring van into a state-of-the-art mobile medical clinic where she serves patients and goes into the community. So thank you all so much for joining us. And This evening, we're going to begin by defining, oh no, don't let me leave out my group. Of course, these are the folks that help make things happen in District 7. We have Dr. Leah Davis, and she is my chief of staff. Literally, she can finish my sentences, and everyone needs that person. I'm proud to say that she is a part of Leadership DeKalb for the 2021 class, so she is not with us this evening, but has helped prepare us for this evening. Of course, JP Phillips, he is probably on the call. JP is always available. And of course, tonight, our technician who's making all this happen and who handles all the beautiful graphics that you'll see here this evening that separates District 7 from all other districts, that would be Allison Slocum. And Allison, thank you so much for all you do. The next thing that we have that's going to pop up is, what is flu? And I thought it was really important to define what flu is during this time. And of course, we call it the flu, but technically it's called influenza. And it is a contagious respiratory illness caused by influenza virus. As a general rule, there are over 200,000 hospitalizations from influenza on an annual basis, and an average of 36,000 Americans, and keep that number in mind, die annually due to influenza and its complications. And the bulk of these individuals are 65 years of age or older. And, you know, as I read this and we did our research in District 7, of course, we all know that COVID-19 has had a far more, shall I say, dire impact on our elderly community. So I had never thought about the fact that flu has that same pattern. Allison, if you will, let's go ahead and define what the coronavirus is, often referred to as COVID-19. It too is a respiratory illness, and it can be spread from person to person. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illness. But COVID-19 is defined as a new disease caused by a novel or new coronavirus that has not previously been seen in humans. The next slide that we have for you, because I always like to keep things local. This is the most up-to-date information as of September 20th that we have for coronavirus or COVID-19 cases here in DeKalb County, Georgia. You'll see that currently we have diagnosed 30,000 cases, 30,083 to be exact. We have had 2,057 hospitalizations, and in DeKalb County, Georgia, we have had 568 deaths as a result of known coronavirus cases. I always like to give the actual zip codes with the highest occurrences, because I think that's very important. You will see that the 30083 zip code, which is Stone Mountain, followed by 30058, which is your Lithonia, Stonecrest, and Redan area. Third is Panthersville and Point Blue, which is your 30034 zip code. The fourth highest rate of known coronavirus cases are in the Belvedere and Candler McAfee area, and that is, of course, your 30032. And last but not least, fifth for the county, for Greater DeKalb, would be Tucker, your 30084 zip code. So I think it's important for us to understand that, you know, as we're moving towards fall, with coronavirus, we are in a unique place because we must protect ourselves. So at this point, we're going to go to the next slide, and we're going to engage those that have the knowledge here to have the conversation that surrounds flu during or in the midst of coronavirus. So Allison, if you will continue with the slides, let's all have the conversation so that we can make an impact and educate individuals on how best to prepare themselves during this unique time as we face a global pandemic. And I'm sure Allison is pulling up the slides that were sent over from the medical professionals, because I believe it was a total of 29 of those. So at this time, if anyone would sort of like to lead into the conversation while she is preparing that slide, let's not waste a moment, because our time will go quickly. Tonight, to everyone that has joined us, this will be an interactive conversation. So we will continue to monitor the chat box. And Allison, I think we can continue down a slide or two. Okay. And we probably, we can go past those numbers, because we did include the highest risk. And whenever you all would like to join in, just we can stop. Should we stop at this slide, and would the conversation start from there?
Sure. Okay. Thank you so much, Commissioner Lorraine, for having us. So I'm Belkis Pimentel. We've already been introduced, so I won't spend any time on that. I'm so excited to be able to be here and talk to you guys and be able to give you some facts and allow you to also ask us questions. So I'll start off. Lorraine, thank you so much. I think you took half of my slides with all that data. So these are the cases that are reported by day in Georgia. So you already heard about DeKalb County and all the data there. So far, there have been cumulative 27,490 confirmed hospital cases. And where you see the red line is actually looking at the 7-day average, just so that you can kind of look at the trend. And we have been coming down, but the last couple of weeks, so the last bit where you see a little bit of increase, that is a little bit delayed with the data. So that may actually change and actually see a higher graph there. Currently, we have approximately 1,406 patients. That's as of yesterday. This data changes daily, sometimes actually by the hour. So any numbers we say, it's probably already stale. And so if you see different numbers, that's the reason why. On the right, we're talking about the confirmed deaths by day for Georgia, so for entire state. And again, that dark purple line is looking at the 7-day rolling average. And at the end, you're seeing like a little bit, it's not as shaded. That is because there's a lot of change in the data as the time goes on, especially in the last 2 weeks. So we expect that to be increased as time goes on. Right now, there are 6,677 total confirmed deaths in Georgia, and that's as of yesterday. Next slide. This is talking about some of the conditions that actually lead you to have complications from COVID and also the flu, and you end up in the hospital, or you end up in the ICU, or worse, you end up dying. So if you're 65 and over, you're at high risk. About 70–80% of the patients who die are 65 and over. So it's a really high risk group. Those who have chronic conditions, regardless, this doesn't matter the age. So they have heart disease or heart failure, diabetes, stroke, high blood pressure, kidney disease, immunocompromised like cancer, HIV. Obesity means that you have your weight and height. Your weight is probably too much for the height that you have. And so that's defined as a body mass index. And for this particular case, who is at increased risk is actually those who have a body mass index over 40. Then we have our pregnant patients. Here, the difference is that the healthy children under 5 are particularly at risk with flu also, not so much with COVID. COVID, if you do have a condition that we mentioned, you are at high risk. Continue. So what are we going to do? Like, right, these are things we already have. There are some things that we can do to kind of help prevent getting either flu or COVID, because it's the same prevention, and optimize your health so you have the best opportunity that if you do get sick, that you can come out on the other side well. So the social distancing that we keep talking about, so that's keeping your at least 6 feet between anybody you're with as much as possible. Washing your hands at least 20 seconds, cleaning and disinfecting surfaces, and making sure you're wearing your mask all the time when you're around others. Not touching your face, not touching your eyes. Along with that, there's some things that we need to optimize our health that we don't think about. We need to get enough sleep. At least 7 hours to 8 hours of sleep as much as we can. I know we lead busy lives. I'm probably one of the first ones not to be able to get as much sleep, but always striving to do that. And then you want to eat a well-balanced diet. And you want it to make sure that, like if you have diabetes, that it's something that's appropriate for diabetes. You want to make sure you're drinking lots of water. Hydration is extremely important. And as well as exercise. And exercise doesn't mean going to the gym. So we're not saying go to the gym, we're saying get out there in the fresh air and walk. And you can do that in wherever there's not a lot of people, because you want to stay away from folks. And then you definitely want to relax. So these are stressful times. Everybody's stressed. But you want to be able to give you some me time and some times that you're doing some meditation. And Dr. Griffith, our psychiatrist, he'll tell us a little bit more about that. You want to have a plan if you get sick so you don't have to go out. And you definitely don't want to delay getting any emergency care just because you're afraid of having COVID, especially if you have underlying conditions. So if you're having that chest pain, call 911, because we definitely need to see you, because that chest pain can lead to actually a heart attack or death, much more than the fear of getting COVID. And want to do get your flu and pneumonia vaccine. So we're going to talk a lot about that. But I think that's a great way to prevent infectious diseases like the flu and pneumonia. We don't have the COVID vaccine yet, but that is coming. So when that comes out and is available for everybody, you also want to get that. I think this is a good time because Dr. Griffith has a little bit of a show and tell for us on what it is like to get the flu vaccine. So Dr. Griffith,
All
you
right.
and your nurse ready for that?
I think we are.
And Dr. Griffith, before you go into the flu vaccine, I just want to say that traditionally, I've not been a person I believe in my 50 years and I'll just say in my adult years, I can only remember having about 3 to 5 flu vaccines. Despite working in corporate America where they would come in and set up, I would describe myself as generally an extremely healthy person. I'm that girl who, if I'm suffering from something, is gastrointestinal or is stress induced because I work a lot and I internalize things and my stuff is personal. But this year, and only honestly because of COVID, I feel there's no way on earth I can't have the vaccine. So I want you to sort of talk about, for such a time as this, I grew up in rural Alabama and very close to the Tuskegee experiment. I attended Auburn University for my MPA. So, there has been, an inherent fear. And I will say that I believe that COVID-19 has brought the disparities in healthcare to the forefront for many. Mm-hmm. And that has been a critical conversation that many elected officials need to have on how do we go about expanding healthcare? What is it we can do to create, when you look at our modern society and other countries that actually have a universal healthcare plan, and we can't seem to make that happen. So, let's talk about, from the most sincere place as a medical professional, why or do you feel that there is even a need this year more than ever to be vaccinated against flu?
All right. Well, thanks, Commissioner. You bring up a lot of very important points, and I have here with us this evening the best nurse that Kaiser Permanente has to offer, Miss Tracy Victor. And she may be administering a flu shot to me. May. Because I have those same concerns as you, and I'm going to ask Tracy some questions before I decide if I'm going to get my flu shot. But first and foremost, I would be remiss if I didn't bring up what Dr. Pimentel just said about stress.
Mhm.
We are in times like no one has ever seen. We're in the midst of two epidemics, one of an infectious disease nature, and the other in regards to systemic racism. If you turn on the news today, you will see unrest, injustice in the streets. And it is these two factors that are affecting us disproportionately, which makes this thing even more difficult. And so there are reasons so the thing about this group here is none of us are native Atlantans.
No.
And we all moved here for a reason, so that we could have a voice and be who we need to be in serving the community and being the best that we could be for our families. And so that's what makes this even more challenging. And so we got to make sure that we have ourselves together mentally and emotionally and providing support within these two very difficult times. So the first question I'm going to have to ask Ms. Tracy is this, is the last time I got the flu shot, I got the flu a couple days after it. So I thought this thing was supposed to prevent me from getting the flu rather than giving it to me. So how did that happen, Ms. Tracy?
So generally, I respond by saying two things could have happened. One is that you were exposed to the flu prior to having the flu vaccine. It takes about 2 weeks for the full effect of the vaccine to come into play. And so that's also enough time for the virus to incubate and then you to start showing symptoms. The second thing that could have happened is after you received your flu vaccine, you may have gotten some side effect type symptoms, runny nose, a slight fever, some malaise. Those things can happen after you've had the flu vaccine. And lots of people confuse those symptoms with actually having the flu. And so we get a lot of this in the clinical area that, you know, the flu shot gave me the flu. And so the way we combat that is, you know, just kind of trying to tease out the events that happen surrounding them having the flu vaccine and, you know, just give a better understanding of what can happen as a result of receiving the flu vaccine. It's really those symptoms that you get after having a vaccine are really normal and natural, and they're what we would expect. We want your body to react a certain way because we know that that means you are developing the necessary antibodies to that organism. Okay. So that's what we want to see.
Well, that makes sense because it's very possible, you know, all the patients I've seen before my immune system kicked in, I may have been exposed to someone in the office or in a store, perhaps, or even church. So that makes sense. Okay, so from that standpoint, I feel more comfortable. Okay, but the next question is this. You know, Commissioner Johnson said something that we know is true, is that several years ago, just down the road in Alabama, the United States government was involved in the Tuskegee experiment, where African Americans had this dreadful disease, syphilis, for years and years and years. And even when there was treatment for it, they allowed these men to continue to harbor disease so they could study what would happen. So now in the midst of this whole pandemic, with the coronavirus, how do I know that this is not part of that this is not necessarily the flu shot, but perhaps this is the coronavirus vaccine that's being given to us now. How do I know that that's not the case?
Well, I would certainly validate your concern because there's just a lot of
or nothing else can happen, and we see something else happen. So, you know, we've looked at the Southern Hemisphere, and some of them have done better with, you know, masking and maybe have lower rates of the flu. We have not done as well in the US. You know, so we really could potentially have a pandemic of flu and COVID. And I think that's why a lot of us are so passionate around trying to get this message out to our population, the populations that we serve, to make sure that at least you have the ammunition to fight against flu. Let's protect against that. Let's take that off the table.
And thank you for saying that. And Dr. Pimentel, you made it very clear, because I sit here and in my singular mind, it never occurred to me that a person could battle both at the same time. Now, I know personally, I suffer from asthma. So I've never been your athletic person. I'd rather sit, read, and do that kind of thing. But I have even taken a lot more precautions in terms of going out and being around people, because I already know that I struggle to breathe, and it's just natural for me because that's what I do. And I'm not one to utilize my inhalers often and so forth. So unless you know that, you won't notice unless we're one-on-one in a quiet room that I breathe like a freight train, okay? But when, you know, understanding that, for me, I really understand when I see so many people in one of the major symptoms they complain with is shortness of breath and the inability to breathe. And, you know, pretty early on, and this just brings me to, because when you look at those symptoms and you look at the symptoms with flu and you look at COVID and you talk of the shortness of breath, I remember in Savannah, because we would get updates in real time for those of us on the commission who chose to join the calls out of DC. And I remember in Savannah at one point, them reaching such a critical state with the amount of COVID cases and hospitalizations that they had no respirators. So there was a real fear there. So my fear becomes, if we are hit with both. So I really want to work with, you know, the medical community more than ever, because you're absolutely right. As I started to do some research and dialogue, we've got to get a handle on this right now. We've got to do whatever is necessary. So I'm going to even see if I can appropriate more money towards even pop-up locations, where we're going into the communities in those 5 zip codes with the highest occurrences of COVID, because we cannot have both. Mm-hmm. And we need to address this right now. So just know that I'm committed to that. So Dr. Phillips, you might need to put JP and the Kid Doc on Wheels bus, and we're going to roll out. And sometimes you have to take help to the people.
Yes.
That's true.
So,
not to cut you off, but you mentioning the Clarkston Community Center, yesterday, Kids Doc on Wheels received a call from the Clarkston Community Center. And they're wanting Kids Doc on Wheels, which I didn't explain what we are and who we are, but we're actually a nonprofit pediatric mobile unit that is providing comprehensive medical care to the community. We establish school-based telemedicine for the families. And so they asked us to come and partner with them to provide the flu vaccine for their pediatric patients. And we're going to happily do that. But one other thing I want to piggyback on what Dr. Griffin spoke about and what Dr. Pimentel and what Commissioner you have stated over and over, that this is a novel COVID-19. This is new. And we have to realize when we say that it's new, we don't know. We don't know anything about this. You know, so as we go each month to month, from season to season, from community to community, everything that's happening is completely new and we don't know. So that's why it's so important for us to minimize what we do know about the flu. We do know that's a seasonal condition. We do know that you do need to get the vaccine every year. But at this time, you know, they're creating the vaccine for this novel COVID-19. So what I would like to just reassure the audience is that, and there was a question that popped up about something historical about it or knowing something or what's going to happen in the future. Please rest assured, we're all clinicians, we're all scientists, but we just don't know. And that's why we're encouraging everyone, protect yourself against the known so that for the unknown, you won't be caught without your life jacket. So
treat everybody as if they have it. You got to treat everybody as if they have it to protect yourself and your loved ones, because there is no treatment other than not to get it. Don't get it. That's the best treatment.
And you know, Dr. Griffith, I'll say to you, and that's why I love folk who deal in facts and data. I love how you were able to say, because of your research, you know, when you looked at Brazil, you looked at other areas, you can utilize the patterns that you've seen there to dismiss the myth that in periods of extreme heat, this virus, because early on, you know, these were all the rumors. So I remember when it was first announced, I said, well, Lord, I just pray it gets hot quick, because that's going to help us with this thing, this unknown that we're battling here. So it's those kind of things, because again, because this was new, it's novel, we don't know, but already facts and data is dismissing some of those claims. I'm going to go back to the questions, because this during these last minutes, that is what I want us to focus on here, are the questions that have been asked by the panel member or by individuals, not panel members, that have joined this conversation. Let's see here. From Miss Gina Papa, she has asked, can Dr. Wilson-Phillips share some pediatric patients, share how pediatric patients can obtain the free flu shots in partnership with Clarkston Community Center? Do they call her office to register? And of course, I will say this, you know, for those of you that are on this call, I hope that all of you are receiving our newsletter from District 7, because this is the type of information that we will certainly have in the newsletter, because, you know, even this conversation tonight has caused me to reshift some priorities right now and commit to doing something differently. So Dr. Phillips, if you can answer that, that would be great.
Sure, Commissioner, we will take you up on you putting it in your newsletter. And so our followers this evening, please stay tuned to the Commissioner's newsletter, and it will be posted with your upcoming publication.
Yes, and Allison, if you will include our website, because my website is Commissioner Lorraine Cochran-Johnson.com. When you go there, the first thing it's going to say is join the movement. And you just type in your email address, and each week you will receive information from me that has critical updates, whether there are food distributions. For those of you who may own small businesses, DeKalb County set aside $15 million for small business expansion, recovery, and stabilization. And we just awarded the first 10 million. All of those things are in my newsletter. And, you know, don't be fearful. When you see information, read it, because those loans are hybrid. The max amount we'll give to any business is $40,000, but it is a hybrid, meaning you will make payment for 1 year and 6 months. Thereafter, you can petition and show that the money has been utilized appropriately, and we will forgive your balance. We're giving you free money. And I just can't impart upon you how much that I feel we as public servants, we've got to tell you all what's available. And, you know, even when it comes to changing how our community looks and businesses, that's my job, is to make sure that you are aware. Now, here's another question from Mr. Harold Smith, and he wants to know, are complications with COVID-19 more severe if you do not get the flu shot? Has anyone seen any data that states that if you get the flu shot, it will help you with COVID in some way?
I don't think we have enough data there. I mean, we're just starting our flu season now, giving the vaccine. I think when we were aware that we had COVID coming in March, I think flu went away. So I don't know that they've actually had any studies that they were looking retrospectively, did these patients have a flu vaccine before? But a good idea. I know that there was some information, there was misinformation on the opposite, that getting the flu vaccine worsens or gives you the COVID. That's actually not true. So I'm glad to hear the question is in the opposite direction. That's a good place to actually look at more research.
And also, Ms. Shirley Page has just shared with us that she said, very good discussion. And thank you so much, Ms. Page. And she says she's been getting a flu shot for the last 20 years with absolutely no complications. I have another individual here, Miss Mary Pegunga, who asks, who states, we're wearing masks, washing hands, and social distancing. Does this help ward off flu as well? I would say yes, even though I'm not a medical professional. You know, washing hands is so critical, and that's why, because of me being how I am, when I get sick, if I get a cold or something, I start wondering, what have you been doing? You know, because I wash my hands and I'm like, what happened here? And I usually am in disbelief, but you know, washing hands is very important. I know healthy diets are, and I'm also seeing a lot of movement towards holistic treatments or preventive medicines in terms of taking your vitamins now. I'm seeing things like sea moss and other products that are selling because people are trying to do what they can from a health standpoint. Let's see.
So the thing is, again, that social distancing and masking and hand washing may in part be responsible why they were having lower rates of the flu in the Southern Hemisphere during their winter months. Back to that question about the flu vaccine and corona and protection of that, it really predates our time. But again, coronavirus, influenza are two separate viruses. So if we were to go back 50, 60 years ago, maybe more than that, before we had the MMR, measles, mumps, rubella, people back in those days could have two of those conditions at the same time. They could have measles and mumps because they're two separate viral entities. And so, you know, so now we kind of, you know, and this is what Dr. Wilson-Phillips, what she does every day. We don't have that anymore because we have had adequate vaccine prevention. And so that's kind of why, you know, this thing, again, it's new and novel. And, you know, again, coronaviruses have been around for a long time. Like the common cold is like a corona. And have we ever been able to find a vaccine for the common cold? I mean, so there's a possibility the vaccine may not be there. It may be with us always. So we got to really be very vigilant to make sure we stay on front of this and treat the things that we can prevent.
Yes, and here's another question from Miss Rebecca Hunt. Why are patients who have COVID, who have COVID/positive COVID test, then when retested 3 to 4 weeks later, test negative, but still symptomatic? Does anyone care to tackle that question?
Yeah, I can tackle that. So when you get sick, actually this happens with both COVID and flu, you actually have long-lasting effects. Some of them can be very debilitating. The fatigue and the cough are probably one of the last ones to go, but we also see people come up with headaches and stomach aches and just feeling ill for quite a while, and everybody's different. So it actually is not the virus that is in you still, it's actually the effects the virus left on your body.
Add to that, one of the emerging things that we're worried about is the heart effects, the cardiac effects.
Mhm.
Finding that people who get COVID, it might be months later, you are at higher risk for certain heart conditions. So, and because this is new, we're learning. So, you know, we might find out that 6 months later, a year later, you are at higher risk for having a heart attack, for having different things like that. So it really is, it does something with your immune system, with the response, that it affects so many areas of your body that we're only finding out more with time.
It's definitely an inflammatory response. We actually see that with flu, that when you have, even if you don't have heart disease, you're at higher risk of having a heart attack the week after you are having the flu symptoms. So we definitely know that it's creating quite a bit of inflammation, and it's not just the lungs, it's affecting a lot of organs. So that's the reason why you want to prevent it completely, because you don't know how you're going to react to the actual flu disease. And I wouldn't be afraid of the vaccine, I'd be afraid of the disease and the long-lasting effects it can have.
Now, I also see here Ms. Page has indicated, and this is the case, Ms. Page, with a lot of healthcare providers right now, that she was scheduled to have a physical exam with Kaiser in June, but she was unable to get her physical because of COVID-19, and she's been on a waiting list since then and still waiting, and that she has the Kaiser Medicare Advantage plan. Can you all speak to, during this time, I know Dr. Phillips, you have been doing a lot of telehealth. Mm-hmm. And right now, is that what is happening pretty much across the board, telehealth? Or are, you know, I was able to go see my physician. And I thought that was strange, but there's about 4 of us in there. And to be honest, I was so happy to just go to a doctor. I can't even tell. I had a great time seeing her. I hadn't seen her in forever because I don't have time to go. So only because of COVID, and now I have a little more time, was I able to go to the doctor. So, you know, can you all speak as to telehealth and what's the latest trends? And is telehealth effective? Because I do like, when I have the opportunity to be seen, it's better to be seen than not, in my opinion. But let's have that conversation, because, you know, a lot of things have forever been changed. And we can't, you know, so we need to do what we can. So let's have the conversation.
So I'll take that one to start off with. Telemedicine is appropriate for particular situations. And so with COVID first coming on and our offices having to close down because we really had to figure it out on what was the best way to protect our staff, protect our clients, our patients and everything, we've all figured it out now. And so we use the telemedicine to do those particular situations that could be managed remotely. But the physical exams, and of course, in order to get the flu vaccine, is something that has to be done in person. I am not a supporter for providing a complete comprehensive physical exam. There's no way that could be done, because there are too many vital signs and everything that we need to have that only you can get by going into your clinician's practice to get the actual vital signs and get them to be accurate. Now, there are some attachments and things that are becoming available through the Apple Watch and, you know, through those gadgets and things of that nature. They are becoming available to take those vital signs for us. But in order to get the true accurate measurements and to have the comprehensiveness of a physical exam, it has to be done in person. So telemedicine has its place for the management of ongoing long-term chronic conditions, to check in if you have hypertension. There are devices available that can check your blood pressure, and your clinician can actually follow up on them via telemedicine. But I do want to present a scenario where there was an 18-year-old that I saw via telemedicine. She had gone to 2 different adult hospitals here in the metro Atlanta area. And it was 5 days into her having symptoms of fever, lethargy, diffuse body aches. She went to the first hospital, tested negative for COVID. She went to the second hospital, tested positive for COVID, ended up with a very low blood pressure on 70/30. And she presented to me via telemedicine 5 days into her course of the condition. And when I saw this young lady lying in her bed, breathing at 50 times a minute. Now, the normal respiratory rate a minute is between, I would say about 16 to 20. Okay, so she's breathing very rapidly. Immediately I was like, I can't believe this is a telemedicine visit. But for this young lady, I immediately told mom that she needed to go to Children's Healthcare of Atlanta, to a children's facility. This mother had to defend and fight for her child to be able to go to Children's Healthcare of Atlanta, with the paramedic stating that Children's does not accept patients 18 and over. That is a misnomer. That is a misunderstanding. So the meaning of me telling this story and the purpose of me telling this story is, number one, do maintain a consistent clinician that's managing your child's care. Secondly, if you have a chronic condition, if your child has a chronic condition and you're over the age of 18, but Children's Healthcare has been involved with the management of your child's condition, they will see you beyond 18 if there's a situation that comes up, because they know that the potential of that chronic condition that's been going on throughout that child's childhood is definitely going to cause consequences if there's something else going on. They will continue to take you. And then third, that we have to be advocates for our children. And so when you reach out to your clinician, if they know your history, they're going to make sure that you get to the right place. So telemedicine is great, but telemedicine has its place, and it should be used in the appropriate times and conditions and situations. So
and what Dr. Wilson-Phillips is describing is an unfortunate consequence of what we call healthcare disparities, is that based upon your zip code and your color, many times you don't get the same treatment, which again is why it's so important that we're doing this, to be an advocate, to be a voice for each of you, for each of us, because all of us live here. This is our home, this is our community. And if we don't help our folks, nobody else will.
Absolutely. And at this point, because it is the end of our chat and conversation here, let me say thank you so much. Everything that we do, being from Alabama, I've learned that manners will carry you places money won't. So humility is a beautiful thing. And I'm very grateful to each of you, because, I don't have the expertise. I just have the desire to help people. So, for all of you, and even those that joined us here tonight on this call, thank you, because, these are critical conversations, and I can truly say that I've learned something. I never thought of having two at the same time. I'm over here, and believe me, I'm going to get my shot, and I think I'm going to document it, because everybody who knows me knows I feel it ain't coming to my door. But this is definitely giving me a new perspective. But at this moment, I'd like to allow each of you to share any closing remarks that you have, and then we will wrap up. And I'll start with Dr. Griffin. He looks as though he has something to say.
I was going to say ladies first. Again, thank you. So fortunate that Commissioner, you're hosting this. But if there's any closing comment, it's like we're in a marathon. Everybody needs to get your flu shot. Everybody needs to keep their mask on, social distance, and practice safety for all of our sake. So again, thanks, and glad that you guys have me today.
Thank you. And Dr. Pimentel?
Yes, ditto that. Thank you so much. I really, really enjoy being on here and also seeing your passion to serve the community. That's actually absolutely beautiful. I hope that we are able to put people at ease with any concerns of the flu vaccine. They go out and get it this weekend. And please take a picture, Commissioner, when you get your flu shot and send it to us.
I am.
Tweet it out.
As a hashtag, Allison, where everyone can take their photos when we send out the email with the information on the dates that we'll administer the flu vaccines and where. And, because also, of course, I'll have 5 or 6 things going at once. We've still got to vote, you guys. I'm very concerned with DeKalb County voting and the administration thereof, whether people are receiving their absentee ballots. This is I believe, the most important election of what's left of our lifetimes. I'm just working on my end to do everything I can to ensure that it goes smoothly. And then of course, we only have until September 31st or 29th, 31st, and the census is over. And wherever we are is where we are. And that's gonna affect us for 10 years, for a whole decade. And right now, we just crossed 62% in DeKalb County, Georgia. We're in a bad position. Last year, we had, census, we were at 72%. By all indications, we're not going to make it. And even then, we were at about 2/3 of the monies that we should have received. And this is critical, guys, because this funds your hospitals, your roads. There's so many things here that are at stake. So I'm gonna take your advice on that, and we're gonna have people upload their shots, but we'll come up with something real cute so that it hopefully it'll be very catchy. And thank you for that. And Dr. Forna, let's hear from you.
Thank you, Commissioner, and your team, I think, for allowing us to talk to our community today. I think one of the things this pandemic is showing us is there are so many unknowns. We're learning so much. This is new, that it's important that you trust your physician or your clinician. It's important that you make a connection because when things like this come up, you need someone who can look you in your eye and you trust them and you believe them. And when you're getting conflicting information, you need to know it's safe to get the flu shot. You need to know that when there is a COVID vaccine, I can look you in the eye and say, I believe in it, I got it, I believe you should get it too. You need that kind of connection. So thanks for giving us that opportunity. And it's a reminder to all of us to find that clinician that you trust, because it becomes important in times like this.
You're absolutely right. And, it reminds me of that old saying, people don't care how much you know until they know how much you care. And that's a very true statement now more than ever. And Dr. Phillips, we're going to allow you to close out these public comments.
Well, Commissioner, I can't thank you enough for the honor to be a part of this phenomenal panel. The talent that we have here speaks to the passion that we have for the community. And so this year is XX 2020. This is the Roman numeral. This is the genes, and I'm my surrounding clinicians, the females are XX. This is the year for us to shine in so many areas. So I encourage you to make sure that your children are counted in the census. Make sure that you design November 3rd, however, that you are going to vote in person. Allow your voice to be heard in person. We're not encouraging you to vote via the mail. And so the last thing that I want to say is do protect your family with the flu vaccine. Take care of what is known. And the women here, we know that we kind of run the things in the household. We wear many hats. And no offense to Dr. Griffin, but we really want to make sure that we shine this year. Do not let the judicial leader that died recently, all her work go in vain for rights for humanity. So let us make sure that we keep that in mind as we move forward through 2020, and let the last 6 months of this year, or I should say the last, 4 months? We're at the end, we're in the last quarter.
Yes.
Let it be better than the first 3 quarters. So 2020, XX, we're doing it. Thank you.
I appreciate those words, and I'm just going to piggyback because every day it feels like almost lately here I learned something alarming. And, you know, when you said do not vote by mail, you know, because we're dealing with COVID, we've seen the long lines, and, you know, DeKalb County to a certain extent has a reputation of not being as prepared at the polls. All ballots that are postmarked, and that's why right now, you know, on the federal level, there's a lot going on with our United States Postal Service and our president and funding. Because here in the county, we have made provisions and increased funding to increase poll workers, for PPE equipment, for training. We've hired a communication specialist that's supposed to help get out the word. But they have said, and it has been issued to all offices of the Secretary of State, that any ballots that are postmarked on or before November 3rd will be accepted. However, only 7 days, November 10th, if it's not received and counted by that time, it will be discarded. So I want you to understand the duality of the statement that I just made. If we're waiting until the last minute and we are voting, because to me, why would you say November 3rd? Then that means you need to vote early and you need to have your ballot cast by the 15th to allow at least 2 weeks so that the ballot is in by the 3rd. But why would you let a group of people vote throughout the 3rd and then knowing that it will jam the mail system and we will not have the ability to process all of those ballots? So hear carefully what's being said and govern yourselves accordingly, because this is not the time for us to show up late, uninformed, ill-informed. It's time for all of us, all hues, to be prepared, because I don't like what I'm seeing. And I feel that it's going to cause the disenfranchisement of many people who don't understand the ramifications of voting by mail if you have not voted early. So check your status, because it's also my understanding that there's been another purge. And just make sure that you can be counted and you have a seat at the table. So with that statement being made, to everyone who's joined us again, thank you so much for joining us tonight. Allison, if you will move to close out, thank you, everyone who's joined us. You will be receiving an email with information on the free vaccines we'll be giving. And I'll be there all day when we're issuing those vaccines, just to say hi and do how I do. So I'll look forward to seeing you there, and may God bless each and every one of you. And please be safe during these times. Let's have a good night.
Thank you.